A very good day everyone. We welcome you all to JIPMER Health Talk program. I am Ms. Netra. The topic for today's discussion is about autoimmune diseases. Well, joint pain and swelling, morning stiffness, skin lesions, loss of hair, oral ulcers, bluish discoloration of the fingers, dryness in eyes and dryness in mouth can all be the common symptoms of several autoimmune diseases. At times, these features are very subtle that they do not bother us very much, and therefore we do not seek any medical help. But then these symptoms have to be treated timely and appropriately in order to prevent further damage to the body. Well, today's discussion, as I told earlier, is about autoimmune diseases. We have with us some experts who can talk about us regarding various types of issues like what these autoimmune diseases are, whom they can commonly affect, what the symptoms of these autoimmune diseases are, how they are diagnosed and how they are treated. So, to discuss further about this, we have with us Dr. Anna from the Department of Clinical Immunology and Rheumatology, JIPMER, to discuss further about this. So, we welcome you, Dr. Anna.
Namaskar.
So, doctor, can you tell us what autoimmunity means?
Okay. To understand what is autoimmunity, we need to know first what is immunity. Our body has WBCs and the white blood cells and the organs which house these white blood cells such as the bone marrow, spleen and the lymph node. We can consider our immune system to be the soldier protecting us against foreign forces. If the soldier fails to protect and rather attack on people and cause harm, the resulting condition resembles what we call autoimmunity. So, immunity is the ability of our healthy body immune system to defend against various infections and foreign bodies. When instead of protecting our own healthy cells and organs, when the immune system attacks these organs, that is what is known as autoimmunity.
So, what is our immune system made up of?
Our immune system is made up of a group of special cells and organs that defend our body from various infections and foreign insults. These WBCs or the white blood cells and their products develop and live in specialized organs such as bone marrow, lymph node and spleen.
Okay. So, how do these diseases develop? What are the common causes of such diseases?
Okay. So, for this autoimmune disease, there is no single cause. Multiple causes have been implicated. One is genetic factors which may make one more prone to develop these diseases, and the second is environmental factors such as viral infection, exposure to toxic chemicals, ultraviolet rays which can trigger the disease in a person with genetic factors which make them more prone to develop these diseases. Then lifestyle factors such as smoking, alcohol, stress etc. can also play a role. Hormonal factors such as deficiency of vitamin D, increased estrogen etc. can also give rise to these diseases.
Okay. So, what parts of the body does this disease actually affect? So, do they affect a single organ or do they affect multiple organs?
There are different kind of autoimmune diseases. Some of them will be limited to a single organ. Such as if you take certain thyroid diseases are of autoimmune cause and they will affect only the thyroid gland. Then type 1 diabetes mellitus, in which the immune system attacks only the insulin producing cells of pancreas and will cause disease only in that particular organ. Then there are also autoimmune diseases such as rheumatoid arthritis, systemic lupus, systemic sclerosis, spondyloarthropathies etc. which can affect multiple organs of the body such as our joints, heart, lung, brain, kidney, blood cells etc.
Okay. So, who gets these autoimmune diseases? Do they run in families?
As such, autoimmune diseases are very rare disorders. It is not very commonly seen in the community. That said, if there is a family member who is affected by such a disease, their relatives, especially their children, have slightly higher risk of developing the disease in future as compared to someone with no such disease in close family members. However, having such a close relative does not mean that you will definitely develop the disease. Your chances of developing the disease similar to your affected relative will be modified by your lifestyle, environmental exposures, other hormonal factors, etc.
Okay. So, do these autoimmune diseases occur in children also?
Yes, definitely. Many autoimmune diseases are also seen in children, and their symptoms and signs will be different from that of adults. But if they are diagnosed on time and if the correct treatment is started at a particular time, then with regular follow up, these children have a very good chance of leading a normal healthy life.
So, what are the examples of some common autoimmune diseases and how do they commonly present?
So, to give examples of few autoimmune disease, there is rheumatoid arthritis, which commonly affect your joints. So, patient can present as fatigue, increased joint pain and swelling, stiffness of the joints as soon as they wake up from sleep, which lasts for 3 to 4 hours. And these diseases can also affect other organs such as eyes, hair, skin, etc., giving rise to increased redness of the eyes, pain, even loss of vision. Then in diseases such as spondyloarthropathies, low backache in young men, which is increased in early morning, will be one of the features. Then there is the most common autoimmune disease that we encounter, which is systemic lupus, which is commonly seen in young women, where they can have skin disorders such as increased redness, burning and rashes of the skin upon exposure to sunlight, increased hair fall, fever, loss of weight, fatigability, then involvement of major organs such as heart, kidneys, lung, etc. In patients with systemic lupus, women of childbearing age can also have recurrent pregnancy loss as well as complications during pregnancy such as hypertension.
How do these diseases behave over time?
So, most of the autoimmune diseases are chronic, which means that they stay with the patient for a long time. But the disease may not be severe throughout the course. There will be flares or increase in the symptoms followed by long periods of inactive disease. So, we cannot predict how the disease is going to behave in a particular person, which is why the person who is affected with these diseases needs to be in contact with their treating doctor for a long period of time.
As discussed, autoimmune or rheumatic diseases occur due to deranged immune system. Though rare, they can affect anyone with genetic predisposition and symptoms can vary from being subtle to severely deforming condition. Well, now having known about what autoimmune diseases are, we will now discuss briefly about the treatment of these autoimmune diseases. So, firstly to begin with, are these diseases curable with drugs?
So, we need to understand what is cure and what is treatment. Suppose you get a disease like sore throat or pharyngitis, you take some antibiotics for 5 to 7 days and after that the sore throat completely disappears. So, this is what is known as cure. But in diseases like hypertension, diabetes, heart disease, thyroid diseases, etc., patients have to take the drugs for a prolonged duration and it will keep their disease only under control so that complications arising from them can be prevented. So, this is what is known as treatable disease. This cannot be completely cured. So, most of the autoimmune diseases are like these chronic diseases which can be treatable but are not curable at present. But problems happen when the patient stop treatment suddenly without consulting the doctor and stop taking the medicines. Then we again have to start the treatment from scratch and this may not be as effective as a treatment which is started and regularly followed up with the doctor.
Okay. So, what are these medicines? Are steroids the only drugs that are available for treating these autoimmune diseases?
So, the drugs which are used to treat autoimmune diseases are known as immunosuppressives or immunomodulators. So, as the name suggests, they will suppress the immune system which attacks our own body. Steroids, like you said, are the most potent and the most commonly available drugs which are used to treat these disorders. We also have other drugs like mycophenolate mofetil, cyclophosphamide, cyclosporin, tacrolimus, etc., which are used for the treatment of these patients. It's just fancy names, but their main function is to suppress the immune system and prevent it from attacking our own body cells and organs.
Okay. So, how do these medicines work?
So, like we said earlier, it is the white blood cells which attack our own body organs and cells. So, these medicines, steroids and other immunosuppressors, they damage or kill or change the function of harmful WBCs which attack our own body's organs and immune system. So, this way it can help control an uncontrolled immune system and prevent damage to the body's organs.
Okay. So, in what forms are these drugs available in market?
Most of these drugs are available as tablets, but some like cyclophosphamide are also available in the form of injections, and these injections have to be taken in hospital under the supervision of a doctor.
Okay. So, as you said earlier, most of these drugs suppress our immune system. So, if they suppress our immune system, is there a higher risk of getting an infection?
So, white blood cells are the cells which have the function of identifying foreign bodies and germs and protect our body against infection. So, because immunosuppressive drugs damage the harmful WBCs as well as some of the normal ones, it acts like a double-edged sword, weaken the immune system and can increase the risk of infection. However, with regular consultation with your doctor and blood test, we can detect the risk of infection quickly and reduce any damage of infection occurring from these drugs.
Okay. So, is it true that the steroids which are prescribed for these patients are dangerous to our body, and do they come with any side effects?
So, any drug that is used to treat any disease has its own dangerous adverse effect associated with it. Similarly, steroids also have such adverse effects. At the beginning of the disease, we start steroid at a high dose which is individualized as per the patient requirement. When the disease is getting controlled, we gradually reduce the dose. If steroids are not taken as prescribed, it can lead to many complications. Depending on the disease and the organ involved, we usually add on other immunosuppressive drugs so that the dose of steroids can be gradually reduced and stopped. Now, coming to the side effects of steroid, most common side effects that we look for include increase in blood sugar, increase in BP or hypertension, cataract, thinning of skin, increased risk of stroke or heart disease, increased fragility of the bone which makes you more prone to develop fractures. As I said, a short course for short period is quite safe when we are using steroid. Your doctor will also prescribe calcium, vitamin D and other drugs along with the steroids to reduce these side effects, and will regularly investigate you with blood test and other imaging to check if you are developing these adverse effects.
So, is there any harm if a patient does not take treatment?
Definitely. These autoimmune diseases are chronic disorders which will attack our body's various organs and will cause damage to them. So, what do we mean by damage? For example, in autoimmune disease like rheumatoid arthritis, if you do not take treatment, your joints will get damaged and deformed. So, you will have lot of hand and foot deformities which will make it very difficult for you to do your day-to-day activities as well as your even self-care activities. In diseases such as systemic lupus, there will be severe damage to the skin, leaving the patient disfigured, which may be very difficult for a young woman to cope with, because these are the age group where this disease is mainly common. Then they can also have problem to the brain such as a cerebrovascular accident or a stroke, heart disease, lung disease, kidney disease which make them dialysis dependent, and even paralysis of any part of the body which makes them handicapped for life. So, all this damage can occur if these autoimmune diseases are left without treatment. So, yes, it is very important that patients take timely treatment for these diseases.
Then in that case, how long should these medications be taken by the patients? Do they have to be taken lifelong?
So, this is a very common question that we hear from patients when we initiate them on treatment. So, there is no clear cut answer to this. It depends on the patient as well as the kind of autoimmune disease that they have. So, normally we tell them that they have to continue taking medications for 2 to 3 years, because this is the minimum amount of time period which is required to control the highly active disease. Usually after start of treatment, symptoms will reduce and they will remain in a inactive state of disease activity known as remission. So, once they attain this state, we will continue monitoring them for around 1 to 2 years. So, usually after 1 to 2 years of being in remission, if they do not have any new disease activity, we may be able to slowly withdraw some or few of the drugs that they are taking.
Okay. So, treatment has to be continued and the patient must regularly visit the doctor.
Yes, definitely. So, with regular doctor patient interaction, that is with regular follow up from the patient, then only we will be able to change or reduce or increase the dose of their drugs according to their disease activity. So, what we see is that patients who generally follow the doctor's advice and come for regular treatment and follow up usually tend to do well with respect to their disease activity, rather than patient who does not come for follow up for prolonged period of time. So, these patients who do not follow up on regularly are more likely to develop side effects and increased damage from their disease.
Okay. So, how frequent should these patient visits be?
Again, there is no clear cut specific time period within which they have to come for visits. Generally, at the initiation of treatment, we ask them to come once in 2 weeks or once in a month, depending upon the kind of disease activity they are having. Once we start them on the drugs and their activity is under control, they can be followed up less frequently within a time period of 3 months to 6 months. But it is very important that even if the disease is inactive for long period of time, such as 6 months to 1 or 2 years, the patient need to be in contact with their treating rheumatologist, so that any adverse reactions to the drug or any new organ involvement can be diagnosed as early as possible and be dealt with.
Okay. So, what are the different kinds of investigations that need to be done before the doctor starts treatment or during the course of treatment to the patient?
So, before starting treatment for autoimmune disease, we usually do a panel of blood investigations as well as basic imaging investigations such as a chest X-ray, ultrasonogram of the abdomen, and in certain autoimmune diseases, we will also advise the patient to undergo even CT scan of the lung or MRI of the brain. So, all this test will help us assess which organ systems are most badly involved with their particular autoimmune disease, so that the treatment can be individualized accordingly. So, while on disease, at particular intervals, tests will be done to assess if they are developing any adverse reactions to the drugs that they are receiving, or if they are developing any new disease activity or increase in existing disease activity. So, and these tests will also help in finding out how your disease is responding to the treatment.
Okay. So, in case of discontinuation, can these medications be discontinued all at once, or do they need to be reduced gradually?
So, discontinuing all the medications that a patient on autoimmune disease is taking is very dangerous. Patients with these disorders are usually kept on multiple immunosuppressants, steroids at a very low dose, and other immunosuppressants like azathioprine, cyclosporin, mycophenolate mofetil, etc. So, stopping all these drugs at once will lead to a sudden increase in disease activity and increased damage to the organs, which cannot be controlled sufficiently if we introduce the same drugs that we have been giving the patient previously. So, this is where the importance of regular follow up comes in. We will assess your disease activity, adverse reactions, and slowly taper off the drugs one by one and withdraw them as is feasible, while keeping in mind that which part of your organ involvement or part of your disease activity requires to have treatment.
Okay. So, are some of these immunosuppressive drugs, as we read, also used in the treatment of cancer?
Yes, definitely. drugs such as methotrexate, which is commonly used in the treatment of rheumatoid arthritis, cyclophosphamide, which is commonly used in the treatment of systemic lupus as well as lung disorders associated with autoimmune diseases, all these are also used in the treatment of cancer. But the doses at which we use these drugs to treat autoimmune diseases are comparatively low when compared to the doses at which these drugs are used to treat cancer patients.
Okay.
So, consequently, the adverse reactions and the effect these drugs have on your body will also be different because the dose is different.
Okay. So, can you comment something on the role of alternate systems of medicine like homeopathy, Ayurveda and Siddha in treating these autoimmune diseases?
So, like as a practitioner of allopathic medicines, I cannot comment very effectively on the safety or effectiveness of this alternate systems of medicine such as Ayurveda, homeopathy, Siddha, Ayush, etc. However, if the patient wishes to consult any of these alternate systems of medicines, they need to keep in mind that the allopathic medicines as well as the alternate medicines can have drug interactions which can lead to potentially serious consequences. So, it is very important that both the doctors that they are consulting need to be informed well in advance regarding the kind of treatment that they are receiving from the other end, so that our own drugs can be tapered or dose can be reduced accordingly. So, it is very important to keep all the practitioners that you are approaching for the treatment of your disease in the loop.
Immunosuppressive drugs are the mainstay of treatment for rheumatic diseases. Though they reduce immunity and predispose to infection, early treatment, good drug compliance and regular follow-up can help in adequate control of these diseases. Okay, so now let's discuss about the care that needs to be taken. So specifically, moving on, what are the hygiene measures that need to be taken when a patient is on immunosuppressive therapy?
So, the patients on immunosuppressives are generally prone to develop lot of infections. So, therefore, hygiene measures is very important in preventing these infections. So, it can be divided into personal hygiene, hygiene of your living surroundings as well as food hygiene.
Okay. So, let's start with what is personal hygiene.
So, most of the germs or organisms that cause infections enter our body through our skin, mouth and nose. So, it is very important to maintain hygiene of these parts by taking bath at least once a day, brushing your teeth twice daily, changing clothing at least once a day. Especially after heavy outdoor activities and sweating, clothing needs to be changed. Then hands should be washed before and after preparing food as well as having food, after touching animals, after using restrooms and after performing any gardening or agricultural activities. So, this will help control the chances of developing infection.
Okay. So, any tips on how to keep our house clean?
So, mostly the house has to be broomed and cleaned at least once a day. Then kitchen waste have to be segregated and disposed of in community dispensal areas. Then keeping the restrooms and bathrooms clean. These are the basic things that you can do, and also using antiseptic lotions or disinfectant lotions to wipe the kitchen areas as well as your bathroom as well as the living room floor. This will also help.
Okay. So, doctor, can you tell us what are the precautions that need to be taken if we have animals at home, pets at home?
So, after touching any animal or animal products, you should always wash your hands, and especially after cleaning out animal excretions that are after birth and after cleaning animal cages, it is very important that you either take a bath or at least clean your hands and feet properly. So, this should be sufficient to reduce the infections that you can contract by handling animals, pets or other animals.
Okay. So, what are food hygiene measures?
So, food hygiene measures are quite simple actually. It just involves thoroughly washing fruits and vegetables under running water before peeling or cutting them, and reducing the amount of raw salads, especially made with vegetables which are not thoroughly cleaned. Then ideally not to eat raw meat or fish, and boil milk before you use it.
Okay. Anything else that can be done to avoid infection?
So, when we start patients on immunosuppressive medications for autoimmune disease, it is always best to avoid going to crowded areas such as movie halls, restaurants, marriage halls, etc. It is also advisable not to engage in recreational swimming in lakes, rivers or sea while on immunosuppressive medication, and it is best to avoid contact with anybody in your family or otherwise who is unwell with an infection.
Okay. So, what to do when any one of the family members is unwell?
So, ideally a patient on immunosuppressive medication should not go near a family member or come in personal contact with them if they are suffering from an infection. But if you are the only sole caregiver and you cannot avoid being in contact with the unwell family member, then it is best that you perform strict hygiene measures such as constant hand cleaning, washing of the linens associated with the unwell family member, and generally keep your surrounding areas as well as yourself clean even if you have to go near a family member with any infection.
So, do these patients need to follow any dietary restrictions?
So, generally we do not prescribe any dietary restriction for patients who are on immunosuppressives, but it is important that you follow a very well balanced diet comprising of lot of whole grains, fruits and vegetables. So, it is better to cut down on red meat. Lean meat is good, it can be continued. Then fatty food also should be cut down upon. Then most of this autoimmune disease will have some effect on your cardiovascular health as well as on your kidneys. So, it is best to cut down on the amount of salt intake also. So, pregnant women and nursing mothers who are suffering from these diseases must continue their regular supplementation of vitamin D and calcium. They should also continue taking folic acid and iron supplementation.
Okay. So, is there any particular timing that we need to take drugs when we take food?
So, most of the immunosuppressive drugs that we use tend to have some interaction between food items. So, depending upon the type of drugs that are prescribed to a particular patient, we can tell them to adjust the timing of intake of this drugs with respect to the food timings. So, this is highly personalized and each individual patient has to discuss this with their doctor before deciding when to take these drugs.
During immunosuppressive treatment, one has to take care of not only his or her personal hygiene, but also maintain their house and surroundings clean. Careful handling of domestic animals, if present, will reduce the chances of infection. One has to take a balanced diet to provide nutrition to the body and fight against these conditions. Well, so now as we have discussed earlier, we have come to know that these autoimmune diseases commonly affect several young females. So, since many of these females might be pregnant or might be planning pregnancy, it is also important to address some concerns regarding pregnancy and lactation in these patients with autoimmune diseases. So, by starting off with the most common concern, can these patients have children?
Yes, definitely the chances of having children in a young woman with autoimmune disease is almost as same as people without such illness. They can marry and undergo pregnancy and normal childbirth. The chance of successful pregnancy will be better if you are in constant touch with your treating rheumatologist and discuss with them prior hand your plans of having children.
Okay. So, when should such patients plan pregnancy?
So, ideally pregnancy should be planned when your disease is under good control, so that your doctor can reduce the medicines or change some of the medicines which can be potentially harmful during the pregnancy. Suppose you get pregnant when your disease is highly active, then chances of developing complications during pregnancy will be very high. So, chance of successful uncomplicated pregnancy is high when your autoimmune disease has been under good control for at least 6 months before planning a pregnancy.
Okay. So, any points that need to be kept in mind with regard to disease and treatment when the patient is planning for pregnancy?
So, the woman who is planning to become pregnant undergoing treatment for autoimmune disease should visit their doctor for a pre-pregnancy assessment at least 3 months before they plan pregnancy. So, this assessment includes general checkup, any specific blood and urine test to see how active your disease is, and your medications also need to be checked and seen if they are safe to be continued during pregnancy.
So, what happens if the disease is not under control? So, should pregnancy be avoided in such cases, and what should be done further?
So, pregnancy should be avoided if the disease is highly active in the last 6 months. So, if the patient's disease is ongoing, then they will have to adapt certain contraceptive methods while they are continuing their treatment. So, they can use barrier contraceptives or they can use contraceptive pills also, but the safety of these drugs and methods need to be discussed with their treating rheumatologist and gynecologist to see how helpful it will be while continuing to take the medicines which are used in controlling your disease activity.
Okay. So, now we have understood that pregnancy has to be very well planned in advance in these patients. But what happens when there is an accidental pregnancy?
So, suppose you become pregnant when your disease is highly active and you are on a medication which is known to cause harm to your unborn baby. Do not panic, you have to consult your doctor at the earliest. You may need to undergo certain blood and urine investigations as well as certain sonograms to assess the well-being of your unborn child as well as how active your disease is at that point. So, based on your disease activity at that time point and based on the status of your fetus, you will be given all the necessary information that you need to know to take a well informed decision regarding whether to continue with the pregnancy or to terminate it.
Okay. So, if a patient becomes pregnant, then what are the common problems the patient faces during pregnancy?
So, this is a very relevant question. The problems faced by patients suffering from autoimmune disease during pregnancy can be divided into two. One is the effect pregnancy has on the disease. So, some diseases such as rheumatoid arthritis will get under control when you are pregnant. So, at this time the drugs that you are taking need to be reviewed and the dose may need to be reduced, whereas some diseases such as systemic lupus may increase in their activity while you are pregnant, in which case certain drugs will have to be increased. Then another is the effect the disease has on pregnancy. So, diseases which has effect on your brain, your kidney and your heart can give rise to high blood pressure which can complicate your pregnancy. Especially in women with antiphospholipid antibody syndrome, they have high chance of developing blood clots in vessels which can give rise to spontaneous abortion or reduced growth of the baby.
Okay. So, how closely should the patients be monitored during pregnancy, or let us say how often should they meet their doctor?
So, ideally consultation with your treating rheumatologist should be before planning the pregnancy, once you find out that you are pregnant, and regular visits as scheduled by your rheumatologist depending on the kind of autoimmune disease you have and the kind of complications that your rheumatologist and gynecologist is expecting you to develop. So, after you are pregnant, how frequently you should visit depending upon your kind of disease.
Okay. So, how frequently should these women undergo scans in order to ensure the baby's well-being?
So, the frequency with which pregnant women with autoimmune diseases should undergo scan is similar to that of the general population. So, minimum 2 scans at 16 and 24 weeks is has to be done, and in the first trimester to see that if the child is having any anomalies, that also has to be done. Extra number of scans will have to be discussed with your treating doctor and it will be tailored to the particular complications that your doctor is expecting you to develop during your pregnancy.
Okay, so we've discussed about the common problems during pregnancy. Can you tell us about the problems that patients face during delivery?
So, mostly if there have not been any problems during your entire pregnant period, you can undergo a safe and normal delivery. But because of your disease, if you have been suffering from high blood pressure or any kidney disease or heart disease, then you will have to be monitored very closely, and you will have to be admitted early and undergo an induced labor or even a cesarean section, depending upon the kind of complications that you might have. So, this needs to be discussed prior with your doctor.
So, can the drugs that are taken to control the disease also harm the baby?
So, most of the drugs that we give to control autoimmune disease during pregnancy are unlikely to harm the baby, but this needs to be discussed with your doctor before you become pregnant, so that anything which can harm the fetus can be stopped at least 3 months before becoming pregnant. However, if you are in constant touch with your rheumatologist and your drugs are being constantly reviewed and the doses changed according to your disease activity, it is unlikely that the drugs you take during pregnancy will cause any harm to your baby.
Okay. So, will the baby get the same disease as that of the patient later in life?
So, this is again a very common concern that many pregnant mothers, women have. Although rare diseases like autoimmune diseases are found rarely in people, it is seen that in relatives of family members with autoimmune disease, people are more likely to develop this. So, yes, there is a small chance that your baby can develop a disease similar to yours later in life, but which can be modified by the environmental factors, hormonal factors and other things. So, the risk is low, but still the risk will be higher than that of the general population.
Okay. So, can these babies be breastfed?
Breastfeeding is actually beneficial to a child born to a mother with autoimmune disease taking treatment. So, post delivery the doctors will keep you on drugs which are not usually transmitted through the breast milk and which is not usually known to cause any harm to the baby.
So, if these patients are unable to conceive naturally, is it safe to go for assisted methods?
So, as we see, many of our patients with autoimmune disease can have antiphospholipid antibody syndrome, which can lead them to have multiple abortions. So, this question of assisted reproductive methods do come up. It is safe to undergo assisted reproductive techniques such as in vitro fertilization and ovulation induction, etc., even in women with autoimmune diseases. But this needs to be properly discussed with your gynecologist and your rheumatologist, because the kind of drugs that you take, the doses at which you take it while you are undergoing these methods will have to be reviewed if you are planning to conceive using an assisted method.
Young women with rheumatic diseases on immunosuppressive treatment can safely conceive and undergo normal pregnancy and delivery. The disease needs to be under control before becoming pregnant, and regular follow-up with the rheumatologist and gynecologist is needed for modifying the drugs and dosage. Patients can utilize contraception if disease is not under control. Breastfeeding is safe and must be continued for at least 6 months. Okay. So, now having discussed what these autoimmune diseases are, who they commonly affect, about the treatment, we will now come into another important aspect of controlling these autoimmune diseases, about physical activity. So, can you tell us what is the role of physical activity in arthritis?
Arthritis is a form of autoimmune disease where the joints become painful and swollen. So, due to pain, patients will not use these joints, they completely give up doing any activity. So, this will lead to muscle thinning, weakness, joint contracture, increasing the risk of falls. So, to prevent these, apart from regular medications, patients need to keep up their activity levels by doing some form of exercise.
Okay. So, in that case, what kinds of exercises need to be done under physical activity?
So, generally depending on the kind of disease and disease severity, the kind of exercises that you are prescribed will vary. When you have more severe disease with severe joint pain, swelling or muscle weakness, then you are told to do simple exercises such as stretches, where somebody else will be stretching your joints and keeping your joint mobile and active. As your pain, swelling and muscle weakness improves, you will be prescribed slightly more complex exercises which you yourself will be able to do under supervision or in a group setting. Other than these specific exercises, it is better that the patients also practice regular exercise such as walking, running if it is feasible, yoga and swimming.
Okay. So, if a patient is having pain in the joints, then can they still exercise?
So, this is a very relevant question. How to, in a patient who has been on a regular exercise program for their chronic autoimmune arthritis, if they suddenly develop pain, what to do? So, it is best not to exercise and give rest to your joint or the painful muscle when your disease is active and your joints are swollen. So, the priority here is to control the disease and reduce the pain with drugs and other supportive measures such as heat packs or massages. So, once the pain and swelling subsides, the exercise is started as a low intensity one and slowly increased in complexity as the swelling pain reduces and getting under control.
Okay. So, how much and how frequently should these exercises be done in that case?
So, generally any exercise program, be it a high intensity exercise such as running for long distances or swimming or walking or stretching or even weight training, whichever exercise program that you are considering, it should be done minimum 30 minutes per day, at least 5 days a week for it to be effective.
Okay. So, most of the times these arthritis patients are prescribed with walking aids, and most of these patients tend to have a problem while using these walking aids. So, what do you have to say about them?
So, the problem that most patients face while they use walking aid or when we prescribe it to them is that they think that it sort of handicaps them and that they have to use it regularly for a prolonged duration. But the fact is that these are just aids, they are not treatment. They are just given in order to make their ambulation easier and in order to make the mobility of the damaged parts easier, and the walking aids also help in preventing falls when they are started on a particular exercise regime. So, once the patients are well on the way to recovery, these walking aids can be avoided or stopped from using.
Physical therapy plays a major role in management of rheumatic diseases. Exercises such as walking, swimming and yoga will help maintain joint mobility and prevent falls. Exercise will be advised in accordance with the type of disease and its severity. Well, so in conclusion, autoimmune diseases like any other chronic diseases can be treated and they can be controlled with proper medication. So, the drugs that are commonly used to treat these diseases are called immunomodulators or immunosuppressive drugs. Now, we also came to know that with some precautions and certain lifestyle modifications, we can adequately control these diseases. So, in women with in young women who are in their reproductive period, they can also become pregnant and they can deliver healthy babies provided adequate precautions are taken upon consultation with your rheumatologist. Again, with proper treatment and regular follow-up, this patient can lead a normal healthy life just like the general population. So, for this today upon all this discussion, we would like to thank Dr. Anna for acquainting us about what these autoimmune diseases are, whom they commonly affect, how they present with these common symptoms, how they can be diagnosed and how these diseases can be treated. We also came to know about the different kinds of physical activities that need to be done that the patient needs to do. Well, we hope that this video was useful in clearing all your doubts surrounding autoimmune diseases. Thank you.